How is acute otitis media diagnosed in kids? Imagine your child suddenly pulling at their ear or crying more than usual. That could be a sign of an ear infection, but how do doctors know for sure? Diagnosing acute otitis media in children involves a careful look at their symptoms and a quick examination of their ears. The main goal is to find fluid behind the eardrum and signs of inflammation. Doctors use a special tool called an otoscope, which is like a tiny flashlight with a cone, to look inside the ear. They check if the eardrum looks bulging or red, which suggests pressure and infection. One key sign is if the eardrum is bulging outward, showing that fluid and pressure are building up behind it. Sometimes, there might be ear discharge that isn't caused by an outer ear infection. If a child has had recent ear pain or tugging at the ear, especially within the last 2 days, that also points toward an infection. For very young children who can't tell us how they feel, signs like crying, pulling at the ear, or trouble sleeping are important clues. To confirm the presence of fluid, doctors often use pneumatic otoscopy, which gently puffs air into the ear to see if the eardrum moves normally. If pneumatic otoscopy isn't available, tympanometry can be used. This test measures how well the eardrum moves and helps detect fluid in the middle ear. It's important to distinguish between acute otitis media and other conditions like otitis media with effusion, where fluid is present but there are no signs of infection like pain or fever. In cases of otitis media with effusion, antibiotics are usually not needed. Symptoms like fever, irritability, or hearing difficulties support the diagnosis. For infants and very young children, signs like tugging at the ear, crying, or difficulty sleeping are especially telling. Overall, diagnosing ear infections in children combines listening to the child's history, examining the eardrum with special tools, and sometimes using additional tests. This careful approach helps ensure the right treatment, avoiding unnecessary antibiotics, since many ear infections resolve on their own with supportive care. Remember, always consult a healthcare professional for an accurate diagnosis and personalized advice.